If you don't speak Hindi, this warning is just a collection of shapes. It might contain the most critical health information in the world, but if you can't decode it, the message is effectively non-existent. Medical breakthroughs only work when they are accessible. A message must be translated into a language you understand, and a treatment must be translated into a protocol you can actually follow. This is the hurdle currently facing the HPV vaccine. It is a biological tool designed to neutralize the virus before it can cause cellular damage, serving as a preventative against cervical cancer. But even with the science perfected, global progress has hit a wall. We have the cure, but the traditional methods we use to deliver it to the world are proving too difficult to scale. For years, the standard approach required patients to receive multiple doses of the HPV vaccine, spaced out over several months. This creates what logisticians call friction. In remote or underfunded regions, requiring the patient to return to a clinic 3 separate times leads to a massive drop-off in completion rates. Every required follow-up is another chance for the system to fail. There's also a massive financial burden. A multi-dose regimen forces local governments to spend triple the resources on cold chain storage, transport, and clinical staff just to protect one person. The multi-dose regimen was built for high-resource healthcare systems. For the rest of the world, these logistical demands act as a barrier that keeps cancer prevention out of reach. To solve this, researchers from Massachusetts General Hospital and Harvard Medical School launched a randomized trial in Kenya called the Ken-Shea study. The team tracked 2,275 young women, aged 15 to 20, over a 3-year period to see if a simpler approach could actually provide the same level of protection. The methodology was precise. They compared a group that received the standard vaccine against a control group, using a randomized crossover design to ensure the data was beyond reproach. Every 6 months, physicians collected cervical swabs to track whether the participants developed persistent infections from the most dangerous strains of the virus. This trial was a direct challenge to the medical consensus. The goal was to prove that durable, lifelong immunity didn't actually require the complex, multi-dose regimens we'd used for decades. When the data came back, the results were definitive. Against the 2 most dangerous HPV strains, a single dose of the vaccine achieved 98% efficacy. This changes the entire logistical map. Protecting a person no longer requires a months-long schedule. It requires exactly 1 shot, given 1 time. These findings are already being applied in the field. In Sikkim, India, health officials recently completed a statewide rollout of the vaccine, proving that a simplified protocol can be scaled across an entire population. From a budgetary perspective, the impact is immediate. Reducing the dosage to a single shot allows a public health program to reach twice as many people with the exact same amount of funding. By proving that a single dose works, the researchers effectively took an expensive, elite medical protocol and turned it into a tool that any country can deploy. This chart projects cervical cancer cases to 2100. The red line shows our current trajectory. With multi-dose vaccination, millions will continue to be diagnosed, but the teal line shows a single-dose strategy. By simplifying the protocol, we avert over 49 million cases. Adopting this approach changes the timeline entirely. The model suggests that a single-dose strategy could reach the goal of total elimination decades faster than the multi-dose alternative. Eradicating a disease requires more than just a discovery in a lab. It requires a strategy that can cross borders to overcome poverty and bridge logistical gaps. The single-dose breakthrough finally makes cancer prevention equitable. It makes the cure accessible to the populations that were previously considered too remote or too expensive to reach. The scientific work is already in the vial. Ending cervical cancer now comes down to how efficiently we can deliver that breakthrough to the billions of people who need it. We're watching the beginning of the end for this disease. It isn't just a victory for biology, it is a victory for radical global access.